guys, let's begin our topic today. CSF analysis. Have you ever wondered how a few drops of CSF can reveal so much about what's happening inside the brain and spinal cord? CSF analysis is the cornerstone in diagnosing conditions like meningitis, multiple sclerosis, and even brain hemorrhages. In this video, we will break down the key aspects of CSF analysis, its composition, normal values, and how to interpret findings for such conditions, which are commonly asked in FMG and NEET PG exams. Let's dive in. This chart provides a straightforward guide to interpreting cerebrospinal fluid findings in different conditions. Let's break it down section by section. Initially, normal values of CSF. Opening pressure is 8 to 15 mmHg. Cell count is 0 to 5 cells per microliter. Protein is less than 40 mg per dl. Glucose is 40 to 70 mg per dl and appearance is clear. While coming to the bacterial infections, in bacterial infections, the opening pressure, WBC count, predominantly the polymorphonuclear cells and protein is increased due to inflammatory response, and glucose levels drops because bacteria consumes the glucose, and the CSF often appears turbid due to presence of cells and proteins. While coming to the viral infections, in viral infections there is increase in WBC, mainly the lymphocytes, but other values often stay close to normal and CSF usually remains clear. While coming to fungal or TB infections, there is an increase in lymphocytes and proteins, but glucose levels are reduced. As you notice, the CSF may have a characteristic cobweb appearance, especially in TB, due to presence of fibrin, and slightly cloudy in fungal. Now we have mastered the CSF analysis. Let's do some activity. Let's check the questions. A lumbar puncture in a patient with suspected meningitis shows an increased opening pressure, elevated protein levels, low glucose, and predominantly lymphocytes. What is most likely the diagnosis? Your options are bacterial meningitis, viral meningitis, fungal or TB meningitis, or normal CSF. What do you think, guys? Okay, the answer is fungal or TB meningitis. Explanation, let's refer the table. See, elevated protein levels, low glucose, and predominantly lymphocytes. Let's check it. Elevated lymphocytes, protein levels, and low glucose. Simple. Next, which of the following findings is most likely associated with bacterial meningitis? Normal glucose, increased lymphocytes. Low glucose, increased polymorphonuclear cells. Normal protein, increased lymphocytes. Low protein, increased polymorphonuclear cells. Let's check the answer. Low glucose, increased polymorphonuclear cells. As I say before, bacteria depends on glucose, so low glucose, and predominantly the cells are polymorphonuclear cells which are increased. Next, in which type of meningitis is the CSF glucose levels typically normal? Bacterial meningitis, viral meningitis, fungal meningitis, or tuberculous meningitis? Answer is viral meningitis. Let's wrap up our discussion on CSF analysis. Don't forget to like, share, and subscribe for more simplified medical content, guys. Thank you.